I'm sure it's the same. As soon as I said her name,
Good morning. We're actually going to get started. We have a great crowd. Thank you so much for coming. We wanted to welcome you to today's briefing in honor of National Children's Mental Health Awareness Day. I am Darcy Gradadaro. I'm with NAMI, the National Alliance on Mental Illness, and we're really happy to have all of you here. We have a very nice turnout. We'd like to start this morning by thanking and welcoming Congresswoman Grace Napolitano, who has been a tremendous leader on children's mental health issues and has been wonderful in helping to support this briefing and co-chairs the mental health topic. So, Congresswoman Napolitano.
Good morning, everybody.
Good morning.
And very, very happy to have everybody here today. I welcome my co-chair of mental health, Tim Murphy, back there, and some of my other colleagues, Mr. Tanko. I'm sorry that it's raining outside. It's kind of throwing me off a little bit. Everybody get wet. Thank you, everybody, but you got to thank Ani. Ani's back there. She puts everything together. As you know, Ani's my right hand in mental health. To all of the community organizations that feel like we do, that we need to elevate mental health parity, mental health coverage, mental health for children, for our soldiers, for everybody. To our panelists, thank you for coming and making this briefing possible in May, Mental Health Month. We have, of course, our hosts for breakfast. Thank them, Mental Health America, NAMI, Bazelon Center, National Federation of Families for Children and Mental Health, and the American Academy of Child and Adolescent Psychiatry. As you know, we have been trying for years to be able to ensure that we elevate and destigmatize mental health services. We need to continue that work. Thank you so very much. I have a bill. Hopefully you'll look at it. I think you have some of the information. And ask my colleagues to help get us pass it through so we can start something to begin the preventive efforts for the future of our children, so that we hopefully won't have the tragedies we've had in the past. We belong to the Gun Violence Task Force, of which I'm a member, and that part of it is mental health. And we need to be ensuring that we don't stigmatize those that are truly mentally ill and blame them for things, because they're the victims normally. Thank you. Members of the task force is Mr. Dingle, Enyard, St. Fatah, excuse me, McCarthy, Barber, Perlmutter, Price, Scott, Spear, and Thompson. The Mental Health Task Force, as you well know, has gotten some champions. Amongst them, Meta World Peace, Los Angeles Lakers run our test. Mia St. John, three-time World Boxing Female Champ. Jill Diamond, North American Boxing Federation, and Mark Ballas, Dancing Star, and we're looking for others. So if you have anybody that you know that you think might be helping us raise the awareness, reduce the stigma, and come out and say we need to elevate this to a health standard that everybody else has for other illnesses. Please continue the work. You're tremendous help, and I'm sure we will continue to be moving forward. There's supposed to be a photo, but I don't know about the rain. I think you have some alternatives.
We'll be announcing the backup room in a little bit. We'll send an email out.
We'll send an email so you can take a picture with those folks that are going to be with us. You have a calendar of the events. I won't go to that. I won't waste your time on this. I believe they've handed out the calendar. Yes, so I won't belabor that. So with that, I thank you so very much for your attendance, and let's make this the heck of a May Mental Health Month. Thank you, and God bless.
Thank you so much, Congresswoman Napolitano and Ane, actually, for all your help in organizing the briefing. At this time, we'd like to recognize Congressman Murphy, who's also been a tremendous leader as co-chair of the Mental Health Caucus and on many issues that impact people living with mental illness.
Good morning, and thank you for being here, and thank you for your dedication to this important cause. And it shouldn't have to be a cause, but it is. It is one that we are all joined together, not just to raise awareness, but to really focus action to help treat and cure mental illness. We spend about $140 billion a year in dealing with mental illness in America. And now and then it comes up again in Congress, and people are energized, and then they do something and then forget about it. I oftentimes say that sometimes we delude ourselves into thinking because we did something, we think we did the right thing. And now again, many issues on Capitol Hill where people are talking about issues of mental illness. I know in my role as chairman of the subcommittee of oversight and investigation on energy and commerce, we've had a series, a forum after Newtown dealing with violence and mental illness. We had another hearing dealing with HIPAA and with confusing HIPAA laws and regulations and whether or not people think they can tell anybody if there's a problem. We're going to be continue to do more. I've been many in my district because I wanted to not only break this stigma, but help us really focus on what are the science-based treatments that work. What are we really doing here, and where is this money being spent? Are we spending it well and wisely, or are we just spending it thinking because we're doing something, we're doing the right thing? So as part of a Mental Health Awareness Day, whether you're staff or whether you're a professional working in this field, it's a legitimate question to always be raising, to saying, what works? How are we doing this? How can we improve? Because of mental health professionals, I'm a psychologist myself, because we've been asking these questions, we have ended up coming up with some pretty substantially effective treatments. On one of my jobs, I'm also an officer in the Navy, and I work at Walter Reed National Military Medical Center with PTSD and TBI patients. And when you look historically what happened in the Civil War, World War I, and World War II, and Vietnam, and now, we do have pretty effective treatments in dealing with PTSD. And now new research showing us how to understand how TBI affects PTSD and where we have confusing symptoms. This is some pretty sophisticated things we're doing. And that's important because so often part of the stigma of people with mental illness is thinking no one can help me. And then part of the stigma that society has is to say, those people are strange, they're kooky. You listen to the derogatory terms on television, comedy shows, on talk shows, on crime shows. Would they do that about any other illness, speaking those kind of derogatory terms about cancer or diabetes or anything else? And the answer is no. You don't see comedies and late night TV making jokes about stage 4 cancer. Why would we do that about people who have mental illness? But we do. And so part of our fight is to help people understand we can diagnose these, we can treat these, we need to focus. Certainly on the federal level, I want to focus to make sure every dollar we spend is working to help people get better. Not just helping to keep jobs in Washington, D.C., but getting out there. I know when I go to visit mental health centers, I ask them, if you were in charge, what would you change? And I'm excited and delighted when I hear people who are frontline mental health workers saying, well, I shouldn't have to spend 2 hours on paperwork every time I open a case. I should be working with this person. I should be getting them help if they're homeless. I should be getting this. I know where I can do. But I'm bound up by this federal paperwork. Okay, how would you change it? What do we need to do to be effective? People are filled with ideas. Same thing goes with research. When I look at the NIMH budget of 1.6 billion and NIH about 31 billion, and then how much really goes to deal, for example, with violence and mental illness, we have a long way to go. So I'm excited that you're all here. That I hope this Mental Health Awareness Month becomes one where we really are helping people be aware of what we can do that is right and effective. So thank you so much for all you're doing.
Thank you very much, Congressman Murphy, for your leadership in the House. We really appreciate it. And also we would like to recognize Congressman Tunko, who's here, and wonder if he would like to come up and say a few words. He's been very supportive of mental health legislation, so we appreciate having you here.
Thank you. Good morning, everyone, and welcome to DC. This Mental Health Awareness Day for our children. Look, one of my proudest moments in the New York State Assembly, where I served for 25 years, was championing the efforts of mental health parity, Timothy's Law, which preceded federal parity. And it was a long fight over a number of years, but we would not give up. I committed my energy, my learning curve to make it happen. And one of my proudest moments on the Hill. And New York Hill, the capital. I represent the capital region of New York. Look, it's my fundamental belief that every individual has the right, should have the right and luxury of a nurturing, loving childhood. That's the premise that we should begin with. Too many of our children hurt. Too many of our programs have been cut in schools. We need to advance the resource that will enable them to connect to programs. We need to invest heavily in research. You're looking at an individual that opposed sequestration in the very beginning, opposed it when it was reauthorized and formalized, and will continue to fight sequestration because it's a hidden attack on human services, and we might really regret promoting sequestration. To the policy end, as you know, parity was a beginning to address fairness, equitable treatment, not stepchilding mental health services. Mental illness, mental health disorders deserve to be addressed head-on, like any healthcare situation. But I found it interesting when we were promoting parity in New York. I had the industry come in, the opposing industry come in, and tell me that they didn't want to be told what to do. I said, well, look, you have no problems paying for gallbladders. They have no fundamental value. But when it comes to the brain, you walk away. It made no sense to me. So we kept pushing for fundamental fairness. When they still bellyached, I said, look, you're willing to pay $3 million a year for failed suicide attempts, and you won't give people hope? You won't bring hope to their doorsteps? Unacceptable. So I think there's counterforces to a lot of work that we do. We need to force that we need to address that counterforce head on and show them the facts, the figures of where research has been utilized. It's providing great opportunity. Where services are funded to the level that's appropriate, people get reached. It's about affordability, accessibility, and it's about being real about a budget. We are who we think we are in the budgets we carve. And if we don't think we have value, if we don't think we have worthiness, we'll reach to sequestration and say do mindless, thoughtless cuts. When you lobby the Hill today, don't ask me if I'm for mental health programs only. Because who's going to be against treating the mentally ill? Go the next mile and say, will you put your neck on the line and support revenues that will be utilized for these services? And to that, I will pledge every ounce of my energy to do. Thank you so much. Push hard and push with a sensible approach that mental health services bring hope to countless families. 1 out of every 5 of us is touched by illness or disorder of mental health proportion. Keep that in mind, everybody, all of us on the Hill. Not you, you know it. Keep it in mind. It touches us very dearly. And it touches our children. I pledge revenues for your cause.
Thank you so much. We really appreciate your attendance and your very passionate statement. So thank you. And I had some opening remarks which I won't go into because I think they've been covered exceptionally well by congressional members, which is a wonderful issue to have. So we'll move right into our speakers. We have a very distinguished panel of speakers today. We're going to start this morning with our first speaker, Kana Enomoto. She is the Principal Deputy Administrator at SAMHSA and will share with us innovative initiatives that SAMHSA has invested in to help ensure the availability of effective mental health services and supports for youth and young adults. Please join me in welcoming Kana.
Good morning. Thank you very much. I'm honored to be here today on behalf of Administrator Hyde. I'm going to be talking to you about actually not investments we've already made, but some of the investments that we're making today and that we look forward to making in the future. My esteemed panelists, Dr. Manarino, Dr. Malloy, and Dylan Zinzal will be sharing with you more about the impacts of mental health and mental illness on families, individuals, and communities across the country. I'm going to talk to you a little bit about where SAMHSA is headed and what we're doing to help raise awareness of this incredibly important issue. Mr. Tonko mentioned that 1 out of 5 of us is affected directly. That's in a given year, 1 out of 5 adults and children has a serious emotional disturbance, mental illness, mental health problem, or substance use problem. However, 1/2 of us will have one of these issues in our lifetime. So half of us will have a mental health condition in our lifetimes, and virtually all of us are affected directly because we love somebody who has a mental illness or a mental health problem or substance use problem. So this is something for every family in America. Today at 10 a.m., HHS Secretary Kathleen Sebelius and SAMHSA Administrator Pam Hyde are holding a press briefing at the University of District of Columbia Community College around Children's Mental Health Awareness Day. We're going to highlight stories from young adults from across the nation who receive services to address mental health problems. And we're going to encourage adult allies to step up and provide supports and social connectedness for young people, because we know these are so important, with a focus on employment, education, and housing. Secretary Sebelius is going to announce the upcoming release of the report, Mental Health Surveillance Among Children, United States 2005-2011, and this is really exciting because it's the first time the CDC has had a supplement, Children's Mental Health Supplement, to Morbidity and Mortality Weekly Report, the MMWR. And Dr. Ileana Arias, Principal Deputy Director from the CDC, will be joining them at Children's Mental Health Awareness press event to address the work of CDC in the area of children's mental health. Another important announcement that's going to be made today by Secretary Sebelius will be that the Centers for Medicare and Medicaid Services, in partnership with SAMHSA, is releasing an important new state information bulletin. The bulletin is going to describe effective benefit designs for children and youth with serious mental health conditions. So what Mr. Tonko said, he's going to pledge the revenues to help pay the bills. We're going to help states figure out the best way to do that, to make sure that youth are getting the range, youth and their families are getting the range of services and supports that they really need. Cindy Mann, the Deputy Administrator from CMS, the Center for Medicaid and CHIP Services Director, will be describing the content of the new informational bulletin and its implications for states. In an exciting celebration, Secretary Sebelius is going to present an award to singer, songwriter, and actress Demi Lovato for her work as a role model and a mentor to young adults with mental health and substance use challenges. She's also going to be the honorary co-chair of our event, Ms. Lovato. And Administrator Hyde is going to be releasing the 2013 Awareness Day report, short report, a data report, at the briefing that will be webcast nationally at www.samhsa.gov/children at 3 p.m. Eastern Daylight Time. So this is going to be this year a virtual event, which is going to be emceed by ABC7 WJLA-TV news anchor Leon Harris from Washington, D.C., and will feature these young adults from around the country sharing their stories about social connectedness, about resilience, and about navigating the transitions into adulthood. The virtual event is also going to feature a recorded message from Demi Lovato, who will be providing a message of hope and encouragement to youth and young adults everywhere. In January, following the tragic events in Newtown, Connecticut, the President released a report, Now is the Time, which outlined a 23-point presidential initiative aimed at protecting children and communities by reducing gun violence and increasing access to mental health services. Within Now is the Time is a set of proposals for which HHS SAMHSA will be taking the lead. Included are $130 million in the fiscal year 14 President's budget proposal, including $55 for Project Aware, which will be a state-level grant to improve mental health awareness and increase mental health literacy and referrals to behavioral health services and support systems, which will be $40 million for state grants and $15 million for mental health first aid youth. These programs are going to be braided with funding from the Department of Education and the Department of Justice to increase also the use of multi-tier behavioral frameworks, or positive behavioral intervention in schools, sports, PBIS models, as well as partnerships with the juvenile justice system and police locally. So these are about city, school, police, community, family, youth partnerships, including mental health and substance abuse, so that we can help schools prepare themselves to support families and young people as they emerge with mental health problems, and make sure that those who need services and want services and supports have places to go, as well as have a way to support one another so that families and young people can support each other. This also includes a proposal for $25 million for Healthy Transitions, which will be support to states who want to fund innovative programs to provide services and supports to youth ages 16 to 25 with mental health and substance abuse problems and their families. This will include some focus on peer-to-peer supports, as well as innovative service models such as those that are being tested in Project RAISE and other places. And $50 million will be included, is proposed for behavioral health workforce enhancements. That includes a $35 million proposal, which will be jointly administered between SAMHSA and HRSA, to expand their mental and behavioral health education and training grant program. There's $10 million for a SAMHSA peer professional workforce development program, which will span mental health and substance abuse and will include training for peers, for youth peers, for family peers, and adult peers. And $5 million for the expansion of SAMHSA's Minority Fellowship Program, which will target professionals at the master's level who are interested in working with transition-aged youth. So another piece of the President's proposal, now is the time. The President charged Secretary Duncan from the Department of Education and Secretary Sebelius from HHS to launch a national dialogue around mental health. Because in order to change the conversation around mental illness and mental health in America, we need to have communities everywhere talking about these important issues, to identify local strategies to reduce the negative attitudes and help individuals and families who are in need of access to treatments. The goal of the campaign is to provide youth and adults accurate information about the prevention and treatment of mental health conditions, coupled with open spaces to tell their stories, to ask for help, to share their success, and to support one another. In these community conversations, or for these community conversations, SAMHSA is developing a toolkit which shares some technology from the deliberative democracy world on how to host diverse discussions about common problems and help local communities come up with approaches to solve them. The President strongly believes that communities have the answers to our biggest social problems. So these community conversations will use trained, neutral moderators and the development of the toolkit to frame the conversation, present overall mental health issues facing young people, and along with that, issues to finding the supports and the financing for adequate prevention, treatment, and recovery supports. Communities and mayors from around the country have stepped up and said they are interested in hosting one of these conversations, and foundations around the country are also interested in supporting them. We hope that many communities will choose to use the toolkits and host these dialogues to identify problems to their solutions, because as we know, the best way to reduce negative attitudes about mental illness is to know someone who's struggled with a mental illness and to see that they are just like you and me. They are a part of your family. They're the people that you love. They are as strong and awful as everybody else in the world. And I think these conversations will help bring that out. So in each conversation, we'll have a substantial number of people who have lived experience, young people, family members, adults, as well as the providers who work in the system to help provide that perspective in the communities. We're also joining the White House in identifying public-private partnerships of organizations nationwide who want to make a commitment to stand up and speak up about mental health. We have groups such as National Associations of Schools, colleges, universities, faith leaders, businesses, medical providers, as well as many behavioral health organizations who are in the room today. These groups are committed to engaging in some sort of mental health awareness activity or discussion or hosting a dialogue on their own. And finally, HHS will be launching a new website and doing a social and online media campaign. We'll be using sort of a viral video effort to get people to tell their stories, to talk about their challenges with mental illness and then their success stories around mental health, and having how they can host these conversations in their own community. The Office of the Vice President, the Office of Public Engagement at the White House, all of them are united in helping us have this conversation, making sure that everyone becomes aware of the important issues around children's mental health, and that we can have a more positive conversation and reduce those negative attitudes and get the supports that people really need and deserve. Thank you.
Thank you very much. That was a wonderful presentation, and we appreciate you being here on such a busy day for SAMHSA and HHS. So thank you so much. Our second speaker is Dylan Zindal. Dylan's here to talk with us about the value and importance of programs for youth and young adults living with mental health conditions. He will share how he has benefited from a program in Savannah, Georgia. And there's really nothing like hearing firsthand from a young person about the positive experiences they've had from effective services and support. So please join me in welcoming Dylan.
Good morning.
Good morning.
I like to think
the National Federation of Families for Children's Mental Health for providing me the opportunity to participate in Children's Mental Health Awareness Day. Hi, I'm Dylan. I'm 20 years old. I began to feel different at the age of 13. That is when I noticed a lack of energy and enthusiasm about my life. I started to feel secluded from the rest of society. I was later diagnosed with major depression and bipolar disorder. Part of my issues began from growing up in a home with an abusive father, where I felt so alone and hopeless. Throughout high school, I struggled with my mental illness, which included me being at a psychiatric hospital for a month. Upon being released from a psychiatric hospital, I became a participant of intensive case management through Savannah Counseling Services. Intensive case management assisted with placing me in an apartment of my own. As a participant of intensive case management, I received counseling, while also having access to additional supports in the community, such as access to a psychiatrist and medication management. In my free time, I volunteer at the Reed House, which is a psychosocial clubhouse that assists individuals that suffer from mental health impairments connect socially to their community. Last year, I was introduced to the Youth to Adult program, which is part of the Emerging Adult Initiative funded by SAMHSA. The Emerging Adult Initiative is for 16 to 24-year-olds with mental health challenges as a result of this grant program. Young adults in Savannah have the unique opportunity with transition coaches. I'd like to personally acknowledge my transition coach, Tobias, for providing me with the individualized attention and a connection that will last a lifetime. Thanks for all you have done to assist me in transitioning into adulthood. The transition coaches work together with the young adults to develop a plan to meet their individual transition goals. My personal goals include finding a job and enrolling in a technical school. My coach has assisted me with completing the job applications, conducting mock interviews, and teaching me life skills that are desperately needed as I transition into adulthood. I am also a participant of CHIPRA, which is Children's Health Insurance Program Reauthorization Act. CHIPRA provides me grant opportunities to states, local government, community-based and nonprofit organizations to support children's health insurance enrollment and outreach. CHIPRA also provides young adults the opportunity to assist and learn from individuals that suffer with mental health issues. Better learn to overcome barriers of living with mental health conditions. As a result of CHIPRA, I now have aspirations of becoming a certified peer specialist so that I can continue to lend my support to individuals dealing with the same issues that I have learned to deal with effectively. All of the services and supports I have mentioned have helped me on my road to recovery. I now live independently, have my personal bank account, I am enrolled in college, and can now effectively deal with my mental health diagnosis while also assisting other individuals with mental health issues. I have aspirations of becoming a small business owner. My dream is to own a coffee shop/bakery. With the services and supports that I receive, I am confident that my dreams are possible. I am a firm believer that in America, anything is possible. Thank you for allowing me to share my story. It is my hope that you have learned how you can help other young people as they try to become responsible adults.
That's going to be a tough act to follow. Nice job, Dylan. You'd think you were doing this all the time. That was great. Thank you so much. I'm so glad you came. Our next speaker is Dr. Tony Manarino. Dr. Manarino, we're very fortunate to have. He's been here before and he does a tremendous job. Is the director of the Center for Traumatic Stress in Children and Adolescents and the vice chair of the Department of Psychiatry at Allegheny General Hospital in Pittsburgh, Pennsylvania. Dr. Manarino has extensive experience and expertise in effective community-based programs for youth and young adults and will share with us the value and importance of investing in these programs. Please join me in welcoming Dr. Manarino.
Thank you so much. Good morning. I'm truly honored to be here today in recognition of National Children's Mental Health Awareness Day, and particularly would like to thank Congresswoman Napolitano and Congressman Murphy and Tonko for their really enthusiastic support for mental health on the Hill. I mean, this is something that's been dear to my heart for over 30 years, and to see that level of support is so meaningful. And Dylan, I couldn't be more honored than follow you to talk on behalf of transitional age youth and to be inspired by what you've accomplished. That's really wonderful, and I wish you nothing but the best as you go forward in your life. I would first like to tell you briefly about the National Child Traumatic Stress Network, which is a program that means so much to me and my colleagues, a program that's actually housed within the Substance Abuse and Mental Health Services Administration. It was launched in the year 2000, actually funded in 2001, right around the time of the September 11th terrorist attack. So coincidentally that occurred, but it was timely in its launching. The mission of the NCTSN is to enhance the quality and access to services for children and families across the U.S. who have been affected by trauma. As you can see by the map, we have sites across the country, and actually officially at this point in time, we have programs in 44 states around the country. And it's so gratifying to know that in the 11 and a half years since the NCTSN was started, that we've actually grown from 17 programs to actually a total of 79 as of today. We just had our all-network conference in Philadelphia last week, which is just a wonderful opportunity for all of us to get together and share our experiences. The network has over 10,000 partner organizations, 400,000 professionals have been trained by groups associated with the network. There are all kinds of online resources and other products that are available through the website of the National Child Traumatic Stress Network. So it's been a remarkable network these last 11 and a half years. And I can tell you, in my career, which has spanned over 30 years, it's really been the most marvelous initiative with which I've ever been associated. It's provided an opportunity for collaboration among programs and colleagues around the country that did not exist before. And we've been able to come together and really join our efforts to, I think, create something much better than we could have created on our own. So I'd like to speak a little bit about this very important age group, transitional age group. And I think it's so important that we mention to start out with that at this important age that brain development isn't fully mature. We like to think of youngsters who are 16 to 20 as being fully mature, but they're not. You know, we think about brain development really maturing in the early to mid-20s, but there are lots of very difficult things that our children 16 to 20 are facing without really mature development. You know, also socially and emotionally, they're not as mature as they will be, and we know the tremendous impact that the electronic media can have on kids in this particular age group when they're still vulnerable and still growing. Sadly, and I say again, very sadly, as kids enter this transitional age, a very large number have been affected by traumatic life events. We know that by age 16, that age of the beginning of the transition, that up to 2/3 of American children have been affected by traumatic life events. 2 out of every 3. It's a large number. And just to drill down a bit on those numbers, you know, 25% of all girls have been sexually assaulted by age 18. 10 to 15% of all boys have been sexually assaulted. 20 to 25% of all our children growing up in families have witnessed domestic violence or intimate partner violence. 1 out of 4 American children. We, of course, know a lot about school and electronic media bullying. We know that many of our kids in American society have to deal with traumatic losses and deaths and suicide. So when we think about this tough transitional age, there are certain groups that are most vulnerable, at least from my perspective, by way of this transition. I think about children with developmental disabilities, children with autism and Asperger's disorder. We know that kids with developmental disabilities are more vulnerable to being traumatized and more vulnerable to being exposed to traumatic life events. We don't read much about homeless youth, but there are more than a few American children who are homeless on the streets of this country. And of course, we can't forget about a very special population of lesbian, gay, bisexual, transgendered questioning youth, LGBTQ youth, that are very much at risk for experiencing assault and other types of violence. They are certainly at greater risk than the average American child to experiencing traumatic life events. And this slide just gives you a little bit of a flavor for the kinds of trauma that American children are exposed to. And I think most notably, child abuse and maltreatment, domestic violence. I mean, there are many children, and I was so proud of Dylan for mentioning this, who have grown up with abuse in their lives. It's an extraordinary challenge to overcome. An extraordinary challenge for kids growing up thinking that there must be something about me that's contributing to where I am, when the reality might be that maybe something bad happened to me or my family that I've had to overcome. And so this just gives you a feel for some of the types of events that kids are exposed to. Many children in American society who have been exposed to trauma do demonstrate signs of post-traumatic stress disorder, as Representative Murphy mentioned earlier. The same type of PTSD that our soldiers experience when they return from Iraq and Afghanistan. The sleep problems, the hyperarousal, the numbing of emotions, the same kinds of issues. Our kids also experience depression and other anxiety disorders secondary to this kind of traumatic life event exposure. What happens when kids don't get effective help? When they aren't identified? When kids are not identified, we know that they grow into adulthood with a much increased likelihood of serious psychiatric difficulties, including depression, anxiety disorders, and other suicidal behaviors. We know that adults who were traumatized as children and did not get help overutilized the medical system as adults. And the ACEs study, the Adverse Child Events study that was done a number of years ago, demonstrated that if you've experienced 4 or more traumatic life events while you're growing up, it even results in a shortened lifespan. So we're talking about something very serious here. For college-age youth, you have the academic challenges of being in college, the new freedoms that entail increased responsibilities, concerns about drug and alcohol abuse on campus, sexual assault on campus. And although mental health services in recent years have been increasing on college campuses, we know historically they've been rather limited. For those youth who are not going to college, of course the economy has not been great the last 5 years. There's a lack of jobs for many youth in this transitional age group. The possibility of isolation, not being in school, not working, many still living with home, and the challenges in being with their family. And of course we also have transitional age youth moving out of the system, being emancipated from foster care. And then the very important issue of, for many youth, they've been treated in the child and adolescent mental health system, and they're transitioning to the adult mental health system, and often lost between the cracks, and something that we need to be concerned about. And of course as well, many of the serious adult psychiatric disorders do have their onset often in this 16 to 20 age group, including bipolar disorder, schizophrenia, and personality disorders. But I am here to tell you a message of hope, most importantly. I'm from the Center for Traumatic Stress in Children and Adolescents in Pittsburgh. You know, we evaluate 400 new families every year. And the best message that I can leave you with this morning is that children get better. When we identify who they are, what they've been exposed to, what their diagnoses are, and get them effective treatment, they get better. Thank you.
Thank you very much. What a wonderful message to leave us with, a message of hope. And I think the fact that young people get better is really a testament to what Dylan shared with us, that his life is really on the right track and has great promise. So that's really exciting. There is great hope. Our final speaker today, before we open it up for questions, is Joanne Malloy. Joanne is here from New Hampshire. She is the clinical assistant professor at the Institute on Disability at the University of New Hampshire. Ms. Malloy has extensive experience and expertise in the positive outcomes that can be achieved for youth and young adults when effective mental health services and supports are delivered with cross-systems collaboration, something that's been a major focus for SAMHSA. So please join us in welcoming Ms. Malloy.
Good morning and thank you. It's an honor to be here. Good morning, Dylan. It's wonderful that you're up here. I don't know, I couldn't have done it at your age, so. I'm truly honored to be here and have the opportunity to talk about our experiences in New Hampshire and to share with you how we've worked cross systems. Our group at the Institute on Disability at the University has been working for nearly 20 years with high school age youth across the state to implement a transition intervention that's much like what Dylan talked about for young people with emotional and behavioral disorders. This population challenges us in many ways. First of all, it's a difficult population to identify and define. It may include, many researchers have found that by talking to youth and families, they don't like what we're offering and they don't feel like they belong. So it's a difficult group to engage, first of all. As Dr. Manarino said, a majority of our young people with emotional and behavioral disorders have been victims of trauma and have dismal outcomes as they move into adult life. So youth who have emotional and behavioral disorders may be rich or poor or in between. They live in dangerous neighborhoods or quiet rural communities. They may or may not be identified as having an educational disability. They often abuse drugs and alcohol. They come from all types of cultural and ethnic backgrounds. And again, they are very difficult to engage in treatment. Studies show that between 30 to 60% of youth or adults in our justice system have a diagnosable mental illness. There are a disproportionate number of youth from culturally diverse backgrounds who are subjected to punishments such as suspensions, detentions, office discipline, or even expelled, further driving them away from the places and people who can most help them be successful. The social, emotional, and financial costs are enormous. The last comprehensive connection and opportunity we have to help these youth are while they're in school. Here we see every teacher is likely to have at least a few children with an emotional behavioral disorder in his or her classroom. Teachers that I work with want to ensure success for every child in their classroom. The teachers generally receive little or no training in emotional and behavioral disorders. They receive little training about trauma and what it does to children, and they receive little training in the science of human behavior. School can be an incredibly powerful place and a source of strength and success for these youth. And so I believe it's the primary place where we can intercept the difficult road that a lot of young people face. It's a place where relationship skills can be developed, where social supports can be built, and where the child's personal growth can be fostered. We need to value and support each child. However, by using positively focused interventions and building positive relationships instead of zero tolerance push-out policies, we can work with even the most difficult child. So as we see here, see the number of children that might be in a typical classroom who have significant support needs. And as Dr. Manarino talked about, the environment has a great deal to do with whether your emotional and behavioral disorder is exacerbated or supported. And by pushing children out of school, we're pushing them out of the environment where they can receive those supports that they need. So school can be a place that exacerbates one's emotional and behavioral disorder by having chaotic environment, academic frustration, teasing, bullying, and gangs, segregation, multiple school placements. In other words, you're leaving the school every year or multiple times during a year, going into a new school, going into another school. This happens to a lot of youth because of their emotional and behavioral disorder. But school can also be a protective place, a place where protective factors can be built, as we see here, by being organized, positive, supporting students, positive relationships with adults and peers, caring interactions. So this is the world of positive behavioral interventions and supports that I've been working in for the past few years. And what I began to realize in working with youth who have the highest need is that if we wait till they're 17 or 18 and they're really surfacing in our systems, it's almost too late, because when you look, there's been a history of push out, a history of bad interactions, and so forth. So this is the dropout prevention model that we adopted in New Hampshire. It is a public health triangle where we work with high schools to create positive interactions for all kids, consistency, predictability at the universal level. We help the schools screen students so they see students who are at risk early and put into place evidence-based positive interventions at Tier 2 to keep those students in the classroom learning with the highly qualified teachers. And for those students who need more, the students have significant issues both inside and outside of school. We put into place an evidence-based practice called Renew, which is much like, sounds your experience, Dylan, where you tell people what you need and we follow your lead. So here's the Renew conceptual framework, and I'll probably skip through some of these slides in the interest of time, but it's very, very consistent with SAMHSA promoted system of care values and principles. As you can see here, when we developed Renew, it's been a while now, 17 years, we looked to children's mental health for guidance. Family-driven, youth-guided, culturally competent, community-based. I am very much an inclusion person. I feel that all children and youth should be in our typical social networks and places where they can learn to be valued like anyone else. And so we use the community-based value to drive our work. We also focus on school to career transition. What is a youth doing besides being a risk taker and so forth, but trying to figure out who you're going to be as an adult? What kind of family you want? What kind of home you want? What kind of job do you want? It's not a happy person who sits around with nothing to do all day. And so we want to encourage our young people with goals around being a nurse, being a store owner, being a hairdresser, very typical aspirations. And then there is the disability community has given us self-determination. Nothing about us without us. The whole idea that the young person needs to learn how to make choices, make decisions, problem solve, not avoid problems, which a lot of youth we work with like to avoid problems. Even my own daughter likes to avoid problems. But really attacking them and in a rational way and seeing success so that it breeds success. And that's how we built this model. Now, at our Institute on Disability in New Hampshire, we like to draw a lot. We take out flip chart paper and we sit down with our youth and we take them through this series of questions. Now, I have worked with my friends in mental health, and this is very much a therapeutic interaction. but we try not to make it look that way. So we sit down with the youth and say, tell me your story. Tell me what you're good at and what you feel good about. Tell me about the people in your life. Tell me about your fears, what you're worried about. Tell me about your dreams, and then let's start breaking those dreams into smaller steps. Now, when I said youth are not engaged, this is a very engaging process. Here is a people map from a young woman we worked with beginning about 6 years ago. And she presents all over the country now about her experience. And she said, you know, when I did this map, I realized I do have a lot of people in my life who I can count on. I kind of thought I didn't before. So we put it on flip chart paper so it's real. You'll notice that Dad is in red in the lower corner. She was feuding with Dad at the time. So this tells us a lot about her and also allows her to learn about herself. And here is her dreams map. She wanted to be a firefighter. She wanted to be successful. She wanted to be married with children, live in a big New England house, have a truck. Very normal aspirations, but not easy for a young person who's having trouble even making friends. So where is this young woman today? She's the star of a film called Who Cares About Kelsey, and I have a few copies here for you. She travels all over the country. She is a challenging young woman. I travel with her, but she's making it happen. She's not necessarily going to be a firefighter now. Her mentor has inspired her, and she wants to be a guidance counselor, and she started college courses to go with it. When I met her, she was way off track for graduation, and she's since finished and made it come true. So what we do with our high school students is we track outcomes, because what good is it if it's not working? Here's a cohort of Renew students in one high school. We track their credits earned, which is really important marker of whether you're making it towards a high school graduation or not. We also track what we call ODRs in the field, office discipline referrals. How many times have you been sent to the office? And the average went down for this cohort. When you're not in the office, hopefully you're in class doing your work. We have also started to train our community mental health centers in New Hampshire to implement this model. And they've worked with over 180 youth in New Hampshire, providing this model as a clinical intervention. We've done some clinical studies. We found vast improvement in functioning among youth by approaching them on a positive level and saying, this is about you, not about me. How are we going to work together? We, again, really use the system of care and PBIS values, and they're very aligned. And by not attacking the youth on a sense of saying, you know, you're not showing up for classes, you're not doing this, you're not doing that, it's kind of, okay, we know it's not going well, let's sit down and have a very real conversation about what's happening here. We have been supported by initiatives funded both on the CMS side, Health and Human Services, and the education side. The U.S. Department of Education has been a great supporter of PBIS across the country. We are working with SAMHSA now, a SAMHSA-funded system of care project in New Hampshire that's allowing us to continue this work. And I'm very excited to hear about new initiatives, because hopefully that will blend this work in schools, so that, because I truly do believe school is a tremendous infrastructure for us to be able to use from preschool, early childhood, all the way through high school and hopefully college. And I just want to end with a personal story. Last Saturday, we attended a funeral, a kind of memorial service for a young man who grew up with my son, who killed himself about 2 weeks ago. And it really brought home to me how he was from an intact family, a rural New Hampshire town. They had money. He was white. And yet something was missing for him. And so this hits home for all of us. We need to help work with our children and youth and families to help each one figure out what it is that's missing, where they're headed, support them through the good times and bad times, As Kelsey says to me all the time, you know, when I say I don't want you to help me, I don't really mean it. So we have to get more sophisticated about engaging these youth. So thank you very much for listening and for the opportunity to speak.
Thank you very much for an excellent presentation. I do want to point out that we have leave-behind packets. Hopefully everyone got a copy of these. In there we have a list of the federal legislation pending in the 113th Congress that we're asking for support from congressional offices for. We do have time for a few questions. Actually, Ane, would you like to come up?
I actually just had an announcement.
Absolutely.
Before everyone leaves, I just wanted to say that the member advocate photo, the location has been changed to the Congressional Visitor Center, so we'll be now taking the photo in front of the Lady Liberty statue, which is perfect for our issue and for today. So again, we'll be meeting at 12 noon, and we do have, we will be sending out an email as well. So 12 noon, the CVC in front of the Lady Liberty statue.
Thank you.
Just to add to that, give yourself plenty of time because you'll have to get through security. So.
Great point, thank you. There's a lot of security there, yes. Do we have any questions for the speakers before we just wrap up? We have about 3 minutes. Yes?
I came in kind of late, so I'm not sure if this is going to be but I was just wondering what, if any, long-term options are provided once children are no longer the responsibility of the school and they're transitioning into adulthood and they're not in a system anymore, whether it's a system of care instead of.
I don't know if you want to come up, either of you, in terms of services beyond school. Great question. Thank you.
Well, you know, we don't want to graduate youth to adult mental health services. And so that is a problem, definitely. What we try to do while a youth is in high school is to build relationships with adults and others in their community that they can count on. But I know that SAMHSA has begun to think that transition should increase to age 26. We all realize through the developmental stages that emerging adults need support through those difficult years, but it is a problem still because a lot of youth lose Medicaid eligibility when they leave school or turn 19, whichever comes first, and may not qualify under the adult system as well for support. Now, hopefully, expansion of insurance coverage may help with that, but it is a problem.
Yeah, and the only other thing I would say is there's 2 wonderful technical assistance centers for transition age youth and young adults that are actually supported by SAMHSA and other federal agencies. One is at the University of Massachusetts Medical School, and the other is at Portland State. And they have a lot of wonderful resources for young adults, really up to age 28, because it is such an important transition time in the life of a young person. And they have great information about programs that exist in communities. Clubhouses specifically for youth and young adults, and supported employment, supported housing, supported education, and other programs. So I would really encourage you to go to those sites. They're a wonderful resource. Any other questions, comments? Yes?
My question is for both Joanne and Tony. I wonder if everything you talked about was getting services earlier in children's, either their disease progression or earlier in childhood. Half of individuals with a mental illness will have the first onset by the age of 14, so I think it really does compel us to try to do more by way of prevention and early intervention. What do you think is the biggest barrier for kids getting those services, for families trying to seek those services? And how can the compendium of programs you talked about facilitate that?
Well, no doubt there are many factors that contribute to what you're describing, but I can name 2 quickly, and one would be access to services. There just aren't enough services out there. When children and families try to access services, often there are long waiting lists. Who pays for services and the complications related to insurers and how many visits you get and all of that are a tremendous barrier as well. And we can't forget, and with Congressman Murphy and Congresswoman Napolitano mentioned this morning, there is still a tremendous stigma around mental health. We should not kid ourselves to think that there is not. There's a tremendous stigma, and the more we can help people in American society overcome that stigma, the greater the likelihood they're going to come forward for services.
Yeah, I just want to say one of our partners, the American Academy of Child and Adolescent Psychiatry, reminds us often that we have about 7,500 child psychiatrists in this country currently, with a need at about 20,000. So I know as family organizations, we routinely hear people have to wait 3 to 6 months for an appointment, even with very urgent circumstances. I will say the American Academy of Pediatrics has really stepped up and is doing a really wonderful job with a mental health task force and other tools for their 63,000 members to make sure they're better equipped to address mental health in primary care, and that's really important. I don't know if we need to vacate the room beyond 10 or if we can keep going. Okay, let's go with another couple questions. Yes.
Darcy, I'd like to, nobody's mentioned about supporting parents, but one of the major barriers to getting mental health treatment is that parents don't necessarily know how to use them, why to use them, and there's a lot of things that another peer, another parent can do to help a family member not be isolated. Often we want to help the kid, but we forget that that kid is part of a family, whether it's a birth family, a foster family, or with transitional age youth, it's a family of choice. So getting that parent-to-parent support, not clinical support, peer support, is one of the ways to really connect and deal with that stigma.
Absolutely, great point. Yes. Actually, both of our proposals, or all three of our proposals, Project Aware, the workforce proposal, as well as the healthy transitions, all involve parent-to-parent supports. So the parents, the children, the young adults, the schools, the families, the communities, all partner around Safe Schools, Healthy Students model currently. And so that would be continued in Project Aware. In Healthy Transitions, we did articulate that there would be both the peer-to-peer supports as well as the parent-to-parent supports, because that is for a population, not just those who are already in the child serving system, but also those who are emerging with their first problems in that age between 14 to 24. And so for the parents to make sure, I mean, the initiative was unfortunately started by the issues around Adam Lanza and his mother, who clearly had not been quite engaged with the system. And we think perhaps if they had been, if his mother had known where to go, who to talk to, if there had been other parents, neighbors, friends who could have supported them, things could have been different. So that was clearly a part of our Healthy Transitions proposal. And our peer workforce includes, again, I think I mentioned both youth and parents as peers. We'll go with one last question. Yes.
There's been studies that show the correlation between communication disorders and mental health issues in incarcerated youth. I'm wondering if in any of these programs, if you also use the services of a speech-language pathologist, other communication specialists as part of these programs.
Yes, I think you're absolutely right. As a matter of fact, I have occupational therapist friends who say, are OTs involved, and so. And oftentimes young people, once we see them, they've gotten very good at covering that up, covering some of those issues up. Once we have this conversation with the youth, we do collect data on how they're doing in class and use behavior science to try to isolate where some of the issues are coming from. And so then we may call in a specialist, a special education person, or a nurse, or a specialist in occupational therapy, or a psychologist, or whatever, to help us identify good strategies to assist the student in the classroom. And we do less of that in the job, at the workplace. But you're absolutely right. We need those specialists. We need highly qualified individuals. but we need to change the tenor of the conversation and the interaction. So that's a very good point.
And just as a follow-up, I would say, in all the advocacy efforts, we know there's a shortage of many of the specialized instructional support personnel, so
Yeah.
that could be part of the equation. That
Right.
would be really important.
Absolutely.
Absolutely.
Well, let's thank our presenters again for excellent presentations. Thank you all for sticking around. This has been great, and happy National Children's Mental Health Awareness Day. And eat. Take food.
Good.